Okay, so you've been doing a lot of research on diabetes lately,
You have.
and we're here to kind of help you
Yeah.
process all of that information and give you a little crash course on this topic based on
Right.
everything that you've been looking at.
Yeah. I mean, there's so much to know about diabetes.
There is.
It's one of those things that affects so many people.
Exactly.
And, a lot of times people think, oh, diabetes is just, you got to watch your sugar, but it's
Right.
so much more than that. And there's so many different nuances to it.
Right. And, we're going to be looking at, type 1, type 2. We'll even be looking at gestational diabetes.
Right.
So we're going to try to give you a really full picture of
Yeah.
this whole condition. And
Absolutely.
before we jump into all the different types, maybe we could just take a second to kind of define what diabetes is
Sure. Yeah.
and what it does.
So, at its core, diabetes is a condition where your body has trouble regulating blood sugar.
Okay.
We always hear about blood sugar.
But what that really means is that the glucose in your blood, which is your body's primary source of energy, isn't getting where it needs to go.
Right.
It's not able to enter your cells and be used effectively. And the key player in this whole process is insulin.
Right. Insulin.
Insulin is a hormone, and you can think of it as a key
Okay.
that unlocks your cells to allow glucose to enter.
Got it.
But when you have diabetes, there's a problem with either the key itself or the locks on the cells, so to speak.
I see. So the key's either not working
Exactly.
or there aren't enough keys.
That's a great way to put it.
Okay.
Yeah, there's either not enough keys or the locks have changed.
I see. And that's
Right.
that's where the different types come in.
Exactly.
Yeah.
That's exactly where the different types come in. So you have type 1 diabetes, which is often diagnosed in childhood, where the body's immune system actually attacks the cells in the pancreas that produce insulin.
Oh, wow.
So in this case, there's just no key being made.
Right. It's like no
No.
keys at all.
Wow. And that must be really tough, especially for kids who are growing and
Absolutely.
losing a lot of energy and,
Yeah.
playing and doing all the things that kids do.
It can be incredibly challenging
Yeah.
to manage.
And then there's the more common type 2.
Right.
Right.
Type 2 diabetes, which typically develops in adults.
Yeah.
This is where things get a bit more complex.
Yeah.
In type 2, the body might not produce enough insulin,
Okay.
or the cells may become resistant to insulin.
Right.
It's like the locks have changed,
I see.
and the key doesn't quite fit anymore.
Okay. So it's either
Right.
not enough keys
Not enough keys,
or the keys don't work.
or the keys don't work.
Got it.
Exactly.
And then there's that third type we talked about,
Yes.
gestational diabetes.
Gestational diabetes.
Yeah.
This is an interesting one.
It affects something like 4% of pregnant women,
That's right.
which
It's a pretty significant number.
that's a lot of women.
Yeah.
So how does that one work?
So, gestational diabetes develops during pregnancy, and in most cases, it resolves after the baby is born.
Okay.
But what's really important to understand is that having gestational diabetes increases a woman's risk of developing type 2 diabetes later in life.
So it's like a warning sign almost.
We should think of it that way.
Gotcha.
It's a bit of a red flag
Gotcha.
that, things might be headed in that direction.
So you've given us a lot of things to think about here.
We have.
We've got these different types of diabetes.
Yeah.
And before we get into kind of the heavier stuff, the complications and stuff, I want to talk a little bit about causes
Sure.
and what puts people at risk.
Absolutely. That's a critical part of the conversation.
Yeah.
So let's focus on type 2 diabetes for a moment, since it's the most common type.
Okay.
There are a number of risk factors that can increase your chances of developing this condition.
Okay.
Some of these are things you can't control, like your genes.
Right.
Family history plays a role. If you have a parent or sibling with type 2 diabetes, you're at a higher risk.
I see.
And certain racial and ethnic groups, like African Americans, Hispanic Americans, American Indians, and Asian Americans, also have an increased risk.
Okay.
Now, there are also things you can control, and those are often related to lifestyle choices.
Okay. Like what kinds of things?
Well, one of the biggest factors is being overweight or obese.
Okay.
This puts extra stress on your body's ability to use insulin effectively.
Makes sense.
And then there's physical inactivity.
Right.
The less you move, the less your body needs to use glucose for energy.
Right.
So it becomes more resistant to insulin.
Okay.
Diet also plays a huge role.
Of course.
A diet high in saturated and trans fats, cholesterol, and added sugars can increase your risk.
So all that tasty
Yeah.
junk food, that's not good.
It's all about balance, right?
Yeah. Right. Of course. Of course.
Everything in moderation.
Everything in moderation.
But, those kinds of foods can definitely contribute
It's good
to insulin resistance.
So it sounds like it's really this combination of things. It's
It's
genetics, it's lifestyle,
So complex
all
stuff.
those things.
Yeah.
And in one of these studies that I saw, it said something like 1.6 million
Oh, yeah.
new diabetes cases are diagnosed every year.
That's right.
That's a huge number.
It is a staggering number.
It's a really big number.
And it just highlights how important it is to be aware of these risk factors and to take steps to prevent or delay the onset of diabetes.
Well, I think we need to talk about complications, but before we jump into that,
Sure.
can you explain a little bit about how this ripple effect
Yeah,
of diabetes can cause so many different problems?
absolutely. You see, when blood sugar levels are consistently high, it can damage blood vessels and nerves throughout your body.
Okay.
This reduced blood flow and nerve damage can then lead to a whole cascade of complications.
Right. I've seen headlines about like everything.
It
can
can
make you
affect
laugh.
virtually every organ in your body.
Yeah, it's pretty scary when you start reading about this stuff.
It can be overwhelming
It is, yeah.
to think about all the potential complications.
Yeah. So maybe we could go through some of those
Sure, let's break it down a bit.
just so we have a good understanding of how serious this is.
So, starting with the eyes, high blood sugar can damage the small blood vessels in the retina, leading to a condition called diabetic retinopathy.
Okay.
This can cause blurred vision, floaters, and even blindness.
Oh, wow.
It's actually a leading cause of blindness in adults.
I didn't realize that.
Yeah, it's a serious concern.
Okay.
Then there's the kidneys.
Okay.
High blood sugar can damage the tiny filters in the kidneys that clean your blood.
Right.
Over time, this can lead to kidney disease
Oh,
and even kidney failure.
and then I know there's stuff about nerve damage as well.
Yes, that's another big one.
Okay.
High blood sugar can damage nerves throughout your body, especially in the hands and feet.
Okay.
This is known as diabetic neuropathy,
Right.
and it can cause numbness, tingling, pain, and even loss of sensation.
And this is why you sometimes see people with diabetes
Mhm.
having to have like amputations and stuff.
That's right,
Oh, wow.
because if you lose sensation in your feet, you may not notice sores or cuts,
Right.
and these can become infected and lead to serious complications
yes.
requiring amputation.
And what about heart health? Because I see that everywhere.
Yeah, heart health is a major concern for people with diabetes.
Okay.
High blood sugar can damage the lining of your blood vessels,
Right.
making them more likely to develop plaque buildup.
Okay.
This increases the risk of heart attack, stroke, and other cardiovascular problems.
I see. So this is really serious stuff.
It is, and it emphasizes how crucial it is to manage diabetes effectively.
Yeah. Well, that's a good segue into what I want to talk about next, which is management.
Okay.
You've alluded to personalized treatment plans.
Yes.
What do they actually involve?
So, personalized treatment for diabetes is all about keeping blood sugar levels within a target range. Okay.
To minimize the risk of complications.
Right.
Now, the specific approach will vary depending on the type of diabetes you have
Okay.
and your individual needs.
Right.
But generally speaking, it involves a combination of lifestyle changes and medication.
Okay.
Lifestyle changes are often the first line of defense.
Okay, so what kinds of things are you talking about?
Well, diet plays a huge role.
Right.
Switching to a healthy eating plan that's low in saturated and trans fats, cholesterol, and added sugars is crucial.
Okay.
You want to focus on fruits, vegetables, lean proteins, and whole grains.
Okay.
Portion control is also important. And then there's exercise.
Right.
Aim for at least 30 minutes of moderate intensity exercise most days of the week.
Okay.
This helps your body use insulin more effectively.
And what about medication?
Medication is often necessary, especially for people with type 1 diabetes
Okay.
who don't produce any insulin.
Right.
The most common medication is insulin therapy.
Which involves injecting insulin to replace what your body isn't making.
Got it.
For people with type 2 diabetes, medication may also be needed.
Okay.
There are a variety of different types of medications that can help lower blood sugar levels and improve insulin sensitivity.
And I know that's going to vary a lot from person to person,
Absolutely.
depending on what their condition is.
It's all about finding the right combination of treatments that works best for you.
Right.
And that's where working closely with your healthcare team is so important.
Right.
They can help you develop a personalized plan,
Yeah.
monitor your progress,
Right.
and make adjustments along the way.
Well, I think we've really covered a lot of ground here.
We have.
You know, we've looked at the different types.
Yeah.
We've looked at risk factors.
Yep.
We've talked about those really serious complications.
It's important to understand the full scope of the condition.
It is.
Yeah,
And we've talked about management, which is good news.
right.
You know, there
There are
are
things you can do.
things you can do.
Absolutely.
And one of the things that really struck me, especially after reading that one personal story from the New York Times, is how much of this is about personal empowerment.
Absolutely.
You know, it's not
And
just
it's not just about fate.
about your genes.
It's about making choices.
It's about taking ownership.
It's about working with your healthcare provider.
It's about being proactive.
It's about being proactive.
Yeah.
So for anyone listening out there, you know, if you are dealing with diabetes
Like-
or if you're worried about your risk,
Yeah.
you know, you have power.
You do.
You have power.
You have more control than you might think.
You have more control than you might think.
And knowledge is power.
And knowledge is power, and that's what we're trying to do here.
Exactly.
So keep learning,
Keep asking questions.
keep asking questions, keep advocating for yourself,
Absolutely.
and
And don't be afraid to reach out for support.
that's right. And we're here for you too.
We